Welcome to our monthly lecture series, our Potpourri. For those of you that are online, we appreciate you being here. For those of you that are in person, thank you for coming. This is a great opportunity for each one of us to get something new in just a short period of time. A couple of quick announcements so we don't take up all of Jake's time. Hopefully each one of you have received an additional email beyond our weekly email in regards to the upcoming opportunity to go on the Rhine cruise with Joan Hahn. If you are interested in that Rhine cruise, I have two words to tell you: free airfare, if booked in November. So if you're interested in the Rhine cruise, for those of you that are in class, we have a handout for you. For those of you that are online, I'm sorry, Danube. Well, it's someplace in Europe. Sorry, in Germany. I can't even say that right. See, it's Austria. I let the man over here correct me on this. It's in Austria. It's the Danube, not the Rhine cruise. I apologize. We did the Rhine already. Been there, done that. It's gone. This is the Danube River cruise, August 10th through August 18th. If you want to go on the Danube River, and I'm going to be saying that all the time, please get a hold of Joan, because airfare is free right now for them if you book it in November. So please be aware of that. Also, for those that are in person in place here, there's a handout from the Provo Senior Center on all the different activities that they've got coming up. A travelogue, Thanksgiving lunch, matinee movies. They just want to invite the ElderQuest people to participate also in what they've got going. So we want to let them know that we appreciate them letting us have this classroom for our classes and be able to use their facility. Other than that, the last thing that I have is December 7th is our holiday luncheon. Gwen won't be here, but we'll still hold the luncheon.
Cool name.
So if you're interested in coming to the luncheon in December 7th, you need to RSVP for that now. You need to get a hold of Nancy Jeffries, our treasurer, because it's the 7th at UVU Culinary Arts. That's the first Wednesday of the month. It's our holiday. It's our special luncheon. It'll be a great event. Other than that, I'm going to turn the microphone over to John to introduce our presenter.
Today's presenter is Jake Dalton, and he's going to be talking about Dayton. Oh, okay. Dayton.
Just to throw that out there.
And he's going to be talking about Medicare Advantage here today. He's handed a brochure out to all the people here in the audience, so you can follow along on as he goes through on the screen. I also want to make mention that next semester, I've got a really fantastic lineup of people coming in to do Potpourri classes. Just to give you how about a model trained person, possibly a person on the Holocaust. Oh, how about Icelanders in Utah and stuff like this? We've got some very fantastic stuff coming up this next term, so be prepared. Thank you very much, and here we'll turn it over to Jake.
All right. Is everybody super excited to talk about Medicare? Of all the things you could talk about, right? This time of year, you have heard plenty of Medicare this, Medicare that. Make sure you're getting the most out of your Medicare, right? Free, this and that. Get more benefits. Today, I'm going to talk to you about not just Medicare Advantage. I want to talk to you about all things Medicare. I kind of call this the conversation a lot of people wish they had when they first turned 65 and got onto Medicare, but were maybe not told some of these things, okay? Just the biggest thing I kind of come across when I talk to people is they're just not aware of certain things that were available to them, right? And there's one thing that is for sure, you cannot take advantage of what you're not aware of, right? If you don't know it exists, you certainly can't use it, right? So we want to make sure today we're kind of filling you in on just a lot of different Medicare information, and I highly encourage questions. And hopefully I can answer all of them, right? I'll do my best. So Medicare Advantage, though, is one of the things we'll talk about. And you see on this handout that I gave to you, it has United Healthcare branding. I'm not going to be talking about the specifics of United Healthcare today or the specifics of any one particular company. I kind of want to just talk about Medicare in general and things that's good for everyone to be aware of. If somebody wants to get into the specifics of something, they can always talk to me afterwards if they'd like. Okay. But we just want to make sure you understand all of your different options. And as corny as it sounds, like the commercials say, we do want to make sure you're getting the most out of your Medicare. That sound like a good plan? Okay. So we're going to spend a lot of time here on this, mainly these first 2 pages. Okay, everybody can see that. So first of all, you've got what we call original Medicare, right? Or traditional Medicare. Everybody see that red, white, and blue card there? Okay, most of you, if not all of you, should have one of those cards. If not, it means you probably lost it and you might want to call and get a new one. It's always good to have that, even if you're not actively using that. Depending on the type of insurance coverage you're using, you may or not show that at the doctor's office. But it's still good to have that for your records as proof that you have Medicare, okay? What we call original Medicare is composed of only 2 parts. There are other parts of Medicare, but the government's only offering 2 parts. Part A and Part B, as you see there. A is your hospital coverage, B is your medical or doctor coverage, okay? What gets a lot of people into trouble is when they first get onto Medicare, they kind of assume, hey, everything that needs to happen with Medicare, it's just going to happen automatically. If the government wants me to have something, they're going to send it to me in the mail and I'll get what I get, right? The problem is you run into an issue where there's also what's called Medicare Part C and Medicare Part D, which we'll talk about in a second. Part D is what gets people into the most trouble. If when they first get onto their Part A or Part B, they don't also get Part D and they don't have some other type of insurance coverage, then they get a penalty. Has anyone ever heard of Medicare penalties before?
I've got that one.
Yeah. It's a sore topic. For people that have the penalty, they know very well that they have it. Because once you have it, it follows you for the rest of your life. It never goes away. It comes out of for most people, their Social Security check every month before they get it, penalty taken out first. So it behooves somebody to make sure that they set their Medicare up properly. Now, if you haven't, and you're already on Medicare, what's done is done, right? But for some people, I will still find them without Part D drug coverage. And for those people, it's a conversation to be had about, let's see if we can stop that penalty from growing and getting bigger every month you continue to not have Part D if you don't have some other type of insurance coverage as well. But that's basically your Part A and your Part B, okay? To keep this really simple, traditional or original Medicare is kind of what I call an 80-20 coverage for seniors. That's all it really is, right? For most things you're doing, Medicare's paying 80%. You would be responsible for the other 20%, unless you do something about it. That's the standard default state of Medicare if you don't do something about it. Most people are not in a position where they can probably afford to pay 20% of their medical bills, right? Especially if those bills are really high. So basically the idea behind this is Medicare has given insurance companies an option to offer additional coverage with Medicare to make their coverage better. You could say boost your Medicare or to replace your Medicare, to look at other options that make it better. And that's kind of what I do. Is I'm what's called an independent broker, right? So I represent all these different insurance companies. And there's a lot of them out there. And there's a lot that I have to study up on every year just to be able to offer every different company's options. It's a whole lot of work, but it's worth it. So when I sit down with somebody, we can look at all of the options and see what truly is the best fit for someone, okay? Yeah, is there a way to turn it off or no?
It's on your laptop.
So it's still on there, huh?
It's still on. That's what you're hearing, that echo.
I am hearing that. Let's see. I'm gonna go back to this and see if it'll let me do this. Hello, hello? Is it still there?
It's intermittent for some reason.
Yeah.
It's coming from your speaker though.
Is it throwing off everybody else?
No.
I can ignore it because I'm pressing mute and it's not working for some reason. Who loves technology in here? It's your best friend and sometimes your worst enemy.
Yeah.
Okay, hello, hello. Sounds better now.
Yeah.
Better for the moment, maybe? Okay. So this is kind of what we want to talk about, okay? So you have these 2 different options, option 1, option 2, okay? These are 2 different options that you're able to get to help make your Medicare coverage better. So you're not having to deal with that potential paying 20% of all your medical bills scenario, which I don't think would be ideal for most people, okay? So option 1, okay? The cool thing about my iPad is I can draw and erase and scribble. and then just move on, right? These technology toys are so fun. Okay, supplement. Does anybody know what a supplement is? Has anyone ever heard of a supplement before?
Sure.
Some people, I ask because some people have never even heard of these things before. They were just never told about all their different options. So a supplement is an option. Some people will look at that as an option. It can be a little bit more expensive. So for some people, it can be a little bit of a turnoff. The way a supplement would work is this. Remember how if you just have straight Medicare, right? What we call traditional Medicare. Medicare is paying the first 80%, right? That other 20% that you'd otherwise be responsible for, guess what? If you have that supplement, it pays that 20%. So we're going to do some hard math here, okay? If you're 80% covered by one payer, 20% covered by another payer, what percent is left for you to pay? Those are nice numbers, huh? Those are fun numbers to look at. That means if somebody has traditional Medicare and a supplement, they go to the hospital, they pay $0. They go to the doctor, they pay $0. You do physical therapy for 2 months, you pay nothing. But it has to be Medicare approved. That's the catch. And not everything is Medicare approved.
I think on this section D that you have down here, if you get that in your supplemental insurance, are you still penalized by Medicare?
No, it's all about the timing though. So that brings up the next step. As you see there where she says underneath where it says Medicare supplement, right here. Because supplements do not include drug coverage, right? You must get a separate drug plan. And that is a mistake some people make, right? When they first turn 65 or get onto Medicare, they'll get a supplement, but maybe at 65, they're not taking any prescriptions yet. So they say, why in the world am I going to pay for a Part D drug plan, right? I'm not taking any drugs. Unfortunately, Medicare does not care whether you are taking any drugs or not. Medicare just cares that everybody has this drug coverage, and if you don't, you get penalized. So if you got a supplement back in the day and you did not get a Part D plan with it, there may be a penalty for someone that they need to worry about if they now want to get drug coverage in order to be able to afford their drug coverage or drugs they're taking. You must get a drug plan separately. So these are, just to clarify here, right? These are two separate policies. Medicare supplement is one. The drug plan or Part D plan is the other, okay? So you're dealing with two separate policies that you're paying for. And that can range anywhere from when somebody first turns 65, again, I can't go into too much specific detail because this is an educational meeting and not a sales meeting, which should make you happy to hear, right? So basically, a supplement when somebody first turns 65 might be around $130, $140 a month, okay? Every year as you get older, guess what happens? They don't care if your health gets worse. They're assuming it's getting worse, and they're going to raise the price on you every year. So it's not a question of if, it's a question of how much they're going to raise that cost on you, okay? Year after year, that's going up, okay? Drug coverage, it just kind of depends. Some go up, some go down. You just kind of got to keep your eye on your drug coverage every year. But that's something to be aware of on a Medicare supplement. So is there a case to be made for some people to have that? You bet. Of my clients, I probably have about 10% of my clientele that are on a supplement, okay? There's a reason for it, okay? If people have certain types of health conditions, things that are taking them to the hospital all the time, doctors all the time, sure, paying hundreds of dollars a month for a supplement and drug plan may make more sense than the other alternative we're going to talk about here in a second. Depends on the person.
I'm not sure what you mean by supplement. Is Guaranteed Trust Life, GTL, hospital insurance, is that considered a Medicare supplement?
No, although they do offer one. So that can be a little bit confusing because she mentioned GTL, which is a specific insurance company. GTL offers many different products, again, which I can't go into in detail, but I'll keep this simple. GTL offers things like hospital plans.
Yeah, that's what I've got. Advantage Plus Limited.
And a hospital plan is something that helps supplement what we'll talk about over on the right, Medicare Advantage plans, okay? It is not a supplement. It can be confusing though, because GTL does also offer Medicare supplements. But what you're specifically asking about, a hospital plan,
That's not.
that is not a supplement.
Okay.
I kind of think of a GTL hospital plan as a small little side policy, like an Aflac policy, right? If you ever heard of Aflac, the duck, like Aflac, right? That thing, right? They'll offer these little policies to kind of supplement your main policy, your main health coverage. That's kind of like what a GTL does. Now, when you have a supplement, most people I encounter are not going to have a GTL hospital plan with a supplement. Why? Because the supplement's already covering everything 100% between your supplement and your Medicare. So why pay extra for a hospital plan unless you actually want to go to the hospital and make money? There's a case for that, right? You say, hey, I don't want to just go to the hospital. I want to go to the hospital, and for my troubles and inconvenience, I want to get paid. Sure, you could get a GTL hospital plan in that scenario, okay? I typically wouldn't advise that because you might be paying extra money for no reason except to get paid if you end up in the hospital. But if you never go to the hospital, you're paying for that GTL plan every month for nothing, right? Now, over on option 2, different scenario. Most of what you see on TV, most of the junk you get in the mail, most of the phone calls that you constantly get bombarded with, they're typically referring to option 2 there. You want to know the main reason why? It's more appealing to people. On a mass scale, it's a lot easier to say, hey, rather than paying a couple $100s a month for a supplement and standalone drug plan, right? Like you're looking out over here on the left, rather than paying for these 2 policies every month, hundreds of dollars coming out of your checking account every month, whether you go to the doctor or not. This option 2 over here, guess what? We'll offer you coverage for nothing. 0 monthly premium, okay? At least the majority of the companies, they know that now that if they're not offering a 0 premium option, at least, they're likely losing to the competition that is offering a 0 premium plan because every major company does that now, okay? So when you're talking about your Part C, okay, you're looking at a 0 premium option unless you're looking at an older plan. A lot of the older plans may still charge a premium. The drug coverage that you're required to have, your Part D, okay, that is built into these Advantage plans at no extra cost. Think of it as it's kind of bundled into the plan. So when you have a Part C plan, to keep this very simple, what your Part C plan is doing, it's offered by a private insurance company, not the government, okay? And what that Part C plan does is it combines your A, your B, and your D all into one plan called Part C. So when somebody has a Part C Advantage plan, they in essence have parts A, B, C, and D. Okay, because a lot of people, oh, go ahead.
Which one is AARP's Medicare Advantage? Is it a supplement or it's Part D?
That last word you said gave it away. AARP Medicare Advantage. That's an Advantage plan.
So that's
That's a Part C
option
plan.
2.
Yeah, so to clarify, it is option 2, yes. And Medicare Advantage plan and Part C are synonymous. They're the same thing. So if somebody says they have an AARP Medicare Advantage plan, another way they could say that is I have an AARP Part C plan. It's another way to say it. Same thing, okay? There are a million, well, that's a little bit of an exaggeration, right? But there's a whole lot of Advantage plans out there. That's where most of the confusion comes because most of the competitive Advantage plans have a 0 monthly cost, but they're so different in every other way, right? There are so many different benefits to consider. There's the issue of network, right? Some plans have incredible benefits, but wouldn't let you go to Utah Valley Hospital. There's plenty of plans like that here in Utah, right? Or maybe they cover something really well that you like they have really good dental coverage, but then they don't cover your prescriptions very well. There's so many little pieces to the puzzle, which is why, I mean, if you have the time to become a Medicare expert, I would tell you more power to you. If you can read the books and create side-by-side comparisons and do all that fun stuff, if you got the time and you like that, good for you. That's amazing. But I would tell you this, there's a reason why people like me exist, right? If you have an agent, hopefully they're an agent that's in contact with you all the time and making sure that not only that the plan you have is good enough, but if there's something better, they're making you aware of it. Because every year, I was talking to Roof a little bit earlier here. He's talking about how there's so many different plans out there, but people are hearing so much on TV about new benefits, additional benefits, things that haven't been there before. And that is true. There are new benefits. How do you know whether or not you're getting those benefits? You got to check. Some people, I feel they get so overwhelmed during this time of year, during open enrollment, they take the ostrich approach, right? Bury your head in the sand and just wait for it to all go away. Wait for all your problems to go away, right? It's certainly an option, but it's not going to get you better benefits. That's the only downside, right? So if you want to make sure that, as the commercials say, you're getting the most out of your Medicare, you got to check, right? And ideally, you want to be checking with somebody that doesn't have bias towards one option or another, right? Someone like me that's independent, that kind of represents all those different options, so they can really determine what's best for you. Now, in this world of Advantage plans, okay, I want to bring up another thing. And if you have any other questions, please ask, okay? Because this is where we want to spend most of our time. The very bottom one, see the, what is that, a magnifying glass, I guess, with a plus sign in it? One of the unique things about Advantage plans that they do, that the supplement, right, does not, is what I kind of call these extras. Sorry about my handwriting. I work on electronics and iPads most of the time, so when I actually have to write, it's often not pretty. So hopefully you can read that. Extras, okay? Advantage plans offer a lot of these extras. Does anybody have any idea why the benefits in Advantage plans are called extras? It says kind of right in there. They're things that are offered above and beyond Medicare. They're things that if you just have straight red, white, and blue Medicare, they're things you're not getting. Anybody have an idea what some of those things would be? Things that Medicare doesn't give you, but these Advantage plans do. Free gym membership. She said fitness plan.
Silver stickers or something.
Silver sneakers. That's a great
Yeah.
one. So many
Okay.
people just cannot remember the name of that. You actually remembered. I had a client called Sneaky Slippers once. There's all kinds of things that people come up with to call that one. Long story. It is not Sneaky Slippers. Although if you wore Sneaky Slippers, that'd be pretty cool, right? Maybe Squeaky Slippers. Or Stinky. Stinky, squeaky, sneaky. Yes. So there's a lot of different companies offering it. You may have heard of Silver Sneakers. That's one of the free gym membership benefits. There's another called Silver and Fit. There's another one called Renew Active, right? Depending on what plan you have. So that's one benefit. Any others? I saw some other hands.
I was going to mention the same thing about the silver slippers or whatever it is, sneakers. But anyway, I've heard where they get like cash back for their plans too now, or, money back.
That is one of the newer benefits, right? 5 years ago, that one didn't exist in Utah, right? So what he said is another way to put that is kind of what they call a Part B reduction, right? What you'll see on commercials is they say, hey, let's put money back in your Social Security. That's another way they present it to make it sound really nice. Let's put money back in your Social Security. Technically, what they're saying is accurate. So we'll write some of these down. So there's your gym is one of them, right?
This is really nice. I didn't realize I could join this gym all year. It's paid for.
Yeah.
You just call for a number code. It's terrific.
It goes back to what I said earlier. Sadly, you cannot take advantage of what you're not aware of. One of the greatest things you can do is kind of what I do for anybody that has questions, an annual review on whatever you have, right? Just to make sure you're getting the most you can out of your Medicare, right? What you have may be good, but it doesn't mean there may not be something that is better, right? And the only way to know is to compare and check. So gym is one thing. How about dental? Could anybody use extra dental coverage? Medicare doesn't cover a penny of that. You could be over here on a supplement, right? Paying hundreds of dollars a month and still not get a penny towards dental care. You're still paying for that out of your own pocket on top of the hundreds of dollars you're paying for a supplement, okay? Whereas over on an Advantage plan where you're paying no monthly premium, you can get additional dental on top of that as well for no extra cost. On top of a gym membership, the Part B premium reduction, right? Like John mentioned, right? That's a big one. The reason this Part B premium reduction can be a big deal, sadly, this is one where a lot of people don't even know what's happening. Every month, do you know on average how much most of you are paying for your Medicare just to have it? That red, white, and blue government issued Medicare.
178, 180.
For most people, yep, pretty darn close. For most people, Part A is no cost. Part B is what you're paying for. And for most people this year, it has been $170.10. That's coming out before you even get your Social Security check every month. It's already been taken out. It's already been deducted. So what if you were able to get an Advantage plan that pays a portion of that for you? So instead of $170 coming out, only $120 is coming out because they're paying for a portion of it. Now, a lot of that's going to be dependent on the plan you have. I will say this, a lot of these plans with that Part B benefit, which is a phenomenal benefit, a lot of that is going to be reserved for people that may have like TRICARE benefits or veterans benefits. I talked to so many of those people that they did not even know this was something they could have. And they say, well, I do everything through VA or I do everything through TRICARE. I'll talk to people like that and say, fantastic, keep your TRICARE, keep everything you're doing now. What if we add on to that a Part B reduction? How about as a way to say, thanks for your service, you get some of your Medicare paid for you. And keep doing everything else you're doing. Don't change any of your current habits. Keep going to your same doctors, getting your prescriptions the same way, but have a little bit of reduction in your Medicare costs every month, right? Again, if you're not aware of it, you can't take advantage of it. So that's another big one. How about vision? Some people could use help on eyewear, glasses, things like that. Transportation, that's another one, right? What else? What are some other good ones? Oh, some people use this. Hearing is another one. How about this? Anybody ever use this benefit? The over-the-counter benefit? You get a catalog.
Yeah.
And every 3 months, you can just order a bunch of free stuff, vitamins, supplements, knee braces, non-slip bath mats, a weight scale, Advil, Tylenol, earwax removal kits, all kinds of fun stuff, right?
How about the once a year visit to your house to find out if you're okay? Is that an extra?
It's not extra. Some people love it. Some people hate it. Some people don't want somebody coming in their house, right?
Yeah. You keep getting letters saying we're coming, call.
Some people are literally insulted by it, right? If I need to go to my doctor, I'm going to go to my doctor. I don't need somebody following up with me. Other people are like, you know what? I'm lazy. I know I need to go to the doctor. If they want to come to my house, sure, that makes my life easier. It all depends on the person. A lot of companies are doing that now as a benefit, right? Coming out to you to check on things to make life a little bit easier.
How about phone consultation?
Telehealth is a big one, right? In light of what's happened with COVID in recent years, most of these companies now will do telehealth conversations with your doctors at no extra cost. So most of the time that'll be a zero copay for you. Again, I got to steer clear of going too specific into benefits, but I can kind of keep it general. So does this kind of make sense, everything we talked about? So for people that have TRICARE VA benefits and they feel like they're told by everybody, right? They go to doctors, they're like, you got the perfect setup. You got TRICARE, you got VA. Don't touch your coverage, right? You can't do any better. And that is not true. They can keep everything they currently have with TRICARE and VA, still add a no cost advantage plan on top of it and get additional benefits they're not getting right now.
Well, I'm on TRICARE. I'm a retired military, and you've just opened my eyes to a lot of things I hadn't seen before, and I love it.
For people that were active military at one point, or if they served at least one term for the government, then they can get TRICARE for life. So it's reserved for people. It's good coverage. It's really good coverage. To keep it really simple, you'll have like Medicare, right? Traditional Medicare is your primary coverage. TRICARE for life kind of acts as a secondary and picks up whatever Medicare doesn't pay. So it's fantastic coverage, but again, doesn't mean you can't make it even better because there's other options out there like an Advantage plan. One other thing I want to bring up. People I come across often on TRICARE and VA, again, a lot of those people feel like, I got it all, I don't need anything else. There are a lot of people I talk to as well. What about people that may live here in Utah County that have DMBA, EMI coverage, PEHP, right? Maybe they work for a city or something, right? Those are great coverages. Without going into too much detail, I will only say this. Some of those coverages, you can only have that coverage, right? You can't have additional coverage with it, right? If you get additional coverage, you'll lose that coverage. Depends on what one it is, right? But there are some of them where they will coordinate where you can have them alongside with a no cost advantage plan, add additional benefits. The biggest thing I tell people, if they have a retiree coverage, there's one thing I've seen about retiree coverage over time. It's designed to be a promise to someone in retirement. It's not designed to necessarily be competitive. They just have to keep a promise that they kept you, right? That if you worked for a certain company for a certain amount of time, we'll take care of your health coverage in retirement, right? Just because an option is offered to you or promised to you in retirement doesn't mean it's the best option. How do you know? You got to check. You have to compare. I talk to people on EMI, PEHP, DMBA all the time. And to kind of use the words of John, I will just say this. A lot of their eyes have been opened. once they understand how their retiree coverage compares to what they could get here through what I call the Medicare competitive market, where you have all these different insurance companies having to compete with each other. When you have a retiree coverage, who are they competing with? Nobody. Why? Because it's a take it or leave it coverage. You take that DMBA or leave it. If you want to leave it, just so you know, you can never get it back, right? They use those scary words to keep people on it, right? If you drop it, you'll never get it back. And that is true. But if there's other coverage out there that will do everything that DMBA does or do everything that EMI does or whatever it may be for a lower cost, right? Is it worth a change? Yeah, if you make the change, you just want to make sure before you make the change that it's a positive change. And if it is, you should never have a reason to want to go back to that retiree coverage, right? Because you changed to something better, right? So anybody in that situation, I love talking to those people because yes, it is a very eye-opening conversation. Okay, any other questions about that? So in this world of Medicare, you've basically got really these, I kind of call it 3 options really, right? You can take your chances on Medicare by itself and pay 20% of most of what you're doing. Good luck, right? I wouldn't advise that. Or you can get a supplement with your Medicare, right? Where the Medicare is the primary coverage and your supplement is the secondary coverage. Or the third option is you get a Medicare Advantage plan. That takes the place of your Medicare. You'll still have Medicare because you're still unfortunately paying that $170 the rest of your life, no matter what. But you have an Advantage plan and you get to abide by the terms of the Advantage plan instead of original Medicare. And what that means is instead of you having to pay 20% for most of what you do, like you would on Medicare, you now on the Advantage plan instead get to pay copays. You know what copays are? It's a fixed fee, right? Set dollar amount, whether you're going to the doctor or whether you go to the hospital. I've had clients get 6-figure bills and pay no more than $1,000 for a $150,000 bill from the hospital. Copays are very powerful. And that's what these Advantage plans do for most of your benefits, not all, but for most of your benefits, it's set up where you get to pay this nice copay or fixed fee instead of 20% like original Medicare would have you paying. That's huge, especially considering that Advantage plan has no additional cost.
Speaking about the benefits of having a plan or not, my sister didn't have a plan. All she had was Medicare. And when she passed away, before she passed away, she had the hospital people came to her and had her sign over all her assets to them before she passed, so they could cover her up until her death. So this is what happens basically without this other coverage you have. So I just want to let you know about that.
Yeah, and that sounds like a scenario where Medicaid may have come into play. Because you'll run into some benefits like for example, long-term care. I won't dwell on that too much, but Medicare does not cover long-term care, okay? Which would be like, that's not like a rehab, right? A rehab center after a hospital stay, that's covered on Medicare just fine. But if you have to go somewhere long-term, right? Because a rehab center requires that you're consistently improving. If you're not constantly improving, they're going to kick you out of the rehab center, right? And then you kind of go into long-term care, right? That's your new permanent state of living, right? You're not getting better anymore. That's just the way you are now, right? That's where you go into a nursing home, assisted living, that type of thing. That is not covered by Medicare, okay? In a scenario like that, some people, since the Medicare is not there to help out and they may not have a long-term care plan, they might have to just get onto Medicaid. They might have to spend down all their assets to a point until they can qualify for Medicaid, and then Medicaid will kick in and help cover that long-term care. That's a sad story, but that's what happens to a lot of people if they didn't plan ahead. Yeah.
I had a question. I'm from another state where everybody bought Kaiser. Now, is Kaiser a Medicare supplement or an Advantage plan?
For the
so
most part, they're an
expensive.
Advantage plan, and they're really big in California.
They're an Advantage plan also?
Most of theirs are Advantage plans. Yeah, Kaiser is kind of a big hub of a big healthcare system in California.
And Hawaii.
And there's no Kaiser here. Yeah.
Yeah.
Oh, yeah. It's a couple of different states. I know California.
It was a lot more expensive than the Advantage plans that you have access to here,
Yep.
which I prefer.
Oh, yeah. Big time. Question up here.
How do you find out how much you're paying Medicare? You said $170 and whatever cents. Where do you go to find out how much you are paying that's coming out of your Social Security or wherever it's coming out of?
The easiest place to check would be Social Security. It'll show up on your Social Security statements. If you don't get the statements very often, or you want to see it more frequently or find out more frequently, then it may be quarterly or annual statements. You can call Social Security and they can tell you how much is being deducted from your Social Security before you get your check every month. Yeah,
Okay, you do get the annual statement from, that tells you what your new amount is gonna be. It has that on there when you get that in December for what it's gonna be next year.
now I will mention one thing about that too. Thanks for that, Ruth. Good news for next year. This is the first time I have good news to share about your Medicare premium in over 10 years of me doing this, okay? Every year that Part B premium goes up a little bit, right? If not every year, usually at least every other year. Does anybody know what's happening next year? I don't want to say for the first time ever, because I've only been doing this for about 11 years, but for the first time I've ever seen, the Medicare Part B premium is going down. Time to throw yourself a party. Not that you had no control over it, right? Even if it goes up, oh, well, you can't do anything about it except complain, right? You still got to pay it, but it's going down. So this year, right? 170.10. Next year, it is going to, anybody know what it is, by the way? Is anybody that informed that they know what that number is? Yes. Of course, Charlene.
Charlene?
Charlene, you're wrong. It's 164.90.
I do know for those that were asking how much it was, for most people, it's the 170 unless your income is very high. I forget how high it has to be.
There's
Then it
ranges.
jumps up.
There's brackets, yeah.
So it's a little bit income based, but if you have that high of income, you probably don't care that it's paying more.
Yes, that's your penalty for being successful. You get to pay a little bit more for a while. But eventually, if your income does go down, there's kind of a 2-year look back where eventually then they'll look and see what your income was 2 years prior. And when it's low enough, you'll be back at that 170. I will add something additional to that as well. Some people could pay higher, but there's also the possibility that some people could pay less. Okay. Can anybody think of a reason why someone may pay less or not pay that at all? It's income related. Same reason you could end up paying more. You could also end up paying less if your income is low enough. So there's certain income thresholds where you may qualify to have that paid for you, where it's not coming out of your Social Security. So again, that's something we can look at for your individual situation and see if that may be possible. There's other issues as well down here with your Medicare Advantage where you have Part D, right? Even on Part D, even though you're not paying a monthly premium to have that Part D, you still, for a lot of people, you still might be paying co-pays for your drugs, right? Well, there's different levels of extra help that you can get besides just Medicaid. For some people, right, their income's just too high to get Medicaid. But there's a couple other income thresholds above that where someone may still qualify to not get Medicaid, but maybe have help on paying for their Part D prescriptions, right? All their prescriptions. Some people may qualify to have that $164.90 paid for. So it's not coming out of their pocket. It's covered. So it's called Extra Help. It's a program called Extra Help, okay, where you can contact Social Security and you can do an application to see if that's something you may qualify for. It certainly doesn't hurt to apply and see. Again, we can talk and see if it's something worth doing for you, but that is another thing to be aware of. Depending on your income level, you may qualify to not have to pay that $164.90 at all, which can be helpful to a lot of people. Any other questions on this? There's a bunch of pages of this, but this is where most of the questions, most of the meat and potatoes is on this page.
I have a general question. Is there a supplement that covers you if you're doing international kinds of traveling or living internationally? Or none of them?
The closest thing I can tell you for that would be helpful would be traveler's insurance. Because on these, you have coverage for emergency care and urgent care internationally. But wherever you go, no other country in their right mind is going to try to figure out how to coordinate doing insurance with another country. I mean, that's a big ordeal, right? So what typically happens is you're going to have to pay it while you're out and about traveling somewhere else. And then you would come back to the States to reconcile with your insurance company. So when you're out and about, no, you don't really have any help there, which is why some people will still get traveler's insurance. which I don't know anything about. That's just what I've heard, why some people will get travelers insurance, because they don't like the prospect of maybe having to come up with $20,000 if they have an emergency in some other country. And it's my understanding that travelers can help with that.
Thank you.
Any other questions about this? Everybody an expert now on Medicare supplements versus Medicare Advantage plans? You can go tell your friends what you know now.
Should we be on?
Oh, that's the big question. What do you think the answer is to that? It's sadly the answer I have to give almost 100% of the time, right? What plan is best for me, right? What should I do? It depends on the person. I know the biggest determinant that most people will look at to decide which one they want to do is their budget, right? Some people love the idea of a supplement, but it doesn't matter how much you love it if you can't afford it, right? So for a lot of people, a supplement is just cost prohibitive, right? They can't pay those hundreds of dollars a month for their supplement and standalone drug plan with it to have that really awesome coverage. So then they look at Advantage plans and make the best of it. And frankly, most people I talk to, I'm not saying this is what somebody should do. I mean, most people I talk to, most clients I have, they're on an Advantage plan, even though they have the option to do a supplement. Most of them will do an Advantage plan because that appeal of zero monthly premium is just too great, right? Because you literally start every month at zero, right? You've paid nothing. And the only way you pay something is if what? You go do something. But if you don't go do anything, you don't pay anything. I wish I could get that kind of coverage. I'm young and healthy. I don't do anything. I'd love to have a coverage that's there when I need it if something happens. But while I'm not using it, it's not costing me anything. Now, one caveat, right, to that is that zero premium Advantage plan, you cannot get it unless what? You got to be paying that $164.90 every month. So if you want to trace it back to its source, I guess you could technically say, well, if you're not paying $165 a month, you can't get a zero cost Advantage plan. But legally speaking, and you'll see it on commercials and you'll see it in stuff you get in the mail, they can legally advertise, yes, the Advantage plan is a zero premium. It does not have a monthly cost. That make sense? Okay. We'll talk about this really quick. Eligibility and enrollment. So does anybody know what period we're in right now? The words are tricky. It's kind of getting particular with the words, and almost nobody calls it correctly. Right now, we're in what's called the annual election period. AEP. Us insurance junkies, right? We call it AEP. We live in abbreviations, right? It's AEP. It's what we're living in right now. Our busiest time of the year. Okay. AEP goes from October 15th to December 7th. Okay. What can you do during that time? Change your coverage. How many times can you change your coverage? If you're really bored, you can change it as many times as you want. You can change your plan 5 times. I've talked to a couple of clients that have been confused and not told correct things by other people. And by the time I'm changing them to a plan, it's their 3rd plan change for the enrollment period. It can happen. I don't advise it. It's not very fun, right? So that's something to be aware of. As you see there at the top, Medicare eligibility, we won't spend a lot of time on that because it sounds like most of you have got Medicare, but yeah, you've got to have been in the US for at least 5 years. You've got to be a US citizen. You got to be 65 or older, or if you've been on disability for at least 2 years. So I've got clients 18 years old in their 20s that I help with on Medicare because they've been on disability for at least 2 years. Okay. So that is the other way on it. Okay. Just so people are aware, right? For most of you, this is past, so I'll breeze over it really quick. But IEP is one of the names of one of the enrollment periods. That's when you're first new to Medicare, right? 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after. In case anybody's listening that is new to Medicare, that's a good time to chat. That's where I'll tell people, even if your work gives you the option to continue with their work coverage, even past 65, don't take the work coverage without comparing and learning and knowing what your Medicare options are first. Because for a lot of people, it may make more sense when they turn 65 to join and get onto Medicare coverage, but continue working because the Medicare coverage may be better than their employer coverage at work. So I'll leave it at that for people that are new to Medicare. Okay, so as you see there, you got your annual enrollment period. And what many of you said, right? The open enrollment period, that's different. That goes from January 1st to March 31st. And that is only for people that have a Medicare Advantage plan. So if you have a supplement and a drug plan, This period does not apply to you. It's for people that have an Advantage plan. If for some reason they decide, oh, I want to go back to the other Advantage plan I had before, or I heard about something even better, you can get onto an Advantage plan. You can disenroll from your current one and join another one. Or you can go back to original Medicare during that time. So you could go from your Advantage plan to, if you want to do original Medicare and do a supplement with it, for example. Special enrollment periods are something that often comes up during the year, right? That's outside of AEP, that's outside of OEP. This is if you move, right? Or somebody's retiring, right? They can retire any time of the year and we can help them with their Medicare at that point, right? As long as they're 65. Move is a big one. Did you know that the plans in St. George, for example, are completely different than the plans here? If you move to St. George, you need to get on a plan specific to St. George. The plans here on the Wasatch Front won't cut it for you. So I have clients all the time call me and say, yeah, Jake, I'm moving here, moving there. I mean, if it's a state where I'm licensed, I'm licensed in about 10 states, I can help them. If not, I just say, call a number. I send them on their way, usually with an agent I know. Microphone.
Is that because of the network when you move from one location to another in the same state?
Yeah. Basically, every plan, every Medicare Advantage plan is just designed to work in a certain service area. So only certain plans are available in certain geographic areas. And every plan around here, their geographic area for the most part is Wasatch Front and surrounding counties. And down there, it's just a whole different world. So for the most part, there's a couple exceptions to that, a couple of different plans where you could still carry it down there if you joined it here. But for the most part, you've usually got to look at a different plan. So that's a big one. That's where I'll still help out a lot of my current clients during the year if they move, or if all of a sudden they qualify for extra help. Sometimes in the middle of the year, somebody decides to apply and wants to see, hey, can I get any of these extra benefits? And if they newly qualify for extra help, that's also another opportunity to get on a different plan. If somebody goes into a skilled nursing facility or rehab center, right, and knows they're going to be there for a while, that could be a qualifying condition, right? They may need to go into a rehab center that is not covered on their current Medicare Advantage plan. And so we may want to look at another one to get them on so they can be covered in that place where they're paying a bunch of money for, right? So they don't have to pay as much money. And as you see over there, there could be certain health conditions that qualify you for certain things there. Any question on that? When you can enroll? So now is the most well-known period, but not the only period, right? During AEP. Okay. I'm not going to focus a lot on that. I mean, long story short, people that have Advantage plans really like their Advantage plans. Most people I talk to, I would say the majority, they're in that 98%. They like Advantage plans. But again, when I talk to them and we start getting into what benefits and things are important to them, the majority of those people, I am still able to help them get onto a different Advantage plan that gives them even better benefits than they've been happy with for years on their current plan, right? So again, just a reminder, just because someone's happy with their coverage doesn't mean there's not additional benefits they could also be getting. So I'll kind of leave it at that on that page. And I'll go slow. I don't know what it looks like when I scroll, if it's really choppy.
That's okay.
Okay. This is just specifically talking about Advantage plans. Advantage plans have a network. Has anybody ever heard of an HMO versus a PPO? Those are networks, right? And if I told you what they meant, that still wouldn't help you understand what they are, right? HMO is a health maintenance organization. Well, what does that mean? That's not very helpful either, right? Basically, it's a network. You're confined to that network. Typically, if you go outside of the network of an HMO, you're on your own in terms of paying the cost, okay? A PPO is different, okay? As I was talking to somebody in here where right now they're on an HMO plan, and there's a new PPO plan that has come out for their particular company they're on right now. No additional cost, but they can change from an HMO to a PPO. The difference with a PPO is you can go in or out of your network and still be covered. That's huge if you travel, right? To be able to have that option just in case. It's still cheaper if you stay inside your network, but you can still go outside of your network and still be covered. So that's going to be a big deal for some people. Advantage plans all have a network. You can't just come and go as you please, right? But even if you have a Medicare supplement, which is a little more expansive in terms of coverage, because a supplement does not have a network. You can go to anyone that accepts Medicare, but they still have to accept Medicare. So there's still going to be limitations. Same here with an Advantage plan. You still have to, number one, go to a doctor that accepts Medicare, but also number two, a doctor that accepts the particular Advantage plan you have. So just things to be aware of, right? Number one, you see there, you got to keep paying your Medicare Part B premium on an Advantage plan. Fortunately, you don't need to worry about that too much because why? It's already coming out of your Social Security check every month, whether you like it or not. The Advantage plans cover all the services of original Medicare and additional benefits. Again, that is why people do these. If Advantage plans gave you no additional benefits above and beyond what just straight Medicare is giving you, then what would be the point in joining them, right? You may as well just stay with original Medicare. But the point is they're different. They offer additional benefits. Number three, joining an Advantage plan may affect your current coverage. Again, the biggest case for most of you is going to be if you have maybe have a retiree coverage. Some will coordinate with an Advantage plan, some won't. There's things like TRICARE for Life or VA that will coordinate with an Advantage plan, okay? So it just kind of depends. Number five, I mentioned a little bit. You may qualify for financial assistance. That's definitely something we should look at for you if that's something you're wondering about. We talked about number six too, probably the biggest sore spot for some people, right? If your timing isn't right and you didn't get on a Part D when you were supposed to, you have a penalty. Number seven, we talked about, right? A supplement is not an Advantage plan. You can have one or the other. You cannot have both. Okay. Number eight is obvious. Of course, you have an ID card, right? You can't expect a doctor to bill you according to the terms of your Advantage plan if you don't show them the card for that plan. So typically every new year when you get a new card, you want to make sure you show all your providers the card again, right? Because the cards change every year, especially for next year. A lot of the companies are going to have major changes in their cards. Same protections as original Medicare, right? So people were worried about, well, once you get on an Advantage plan, you're no longer getting your benefits, right, directly from Medicare. You're getting them from the insurance company. That's okay. You still have all the same protections as original Medicare, the similar benefits, except you're getting things additional as well. And then a built-in safety net, right? They call it the annual out-of-pocket maximum. I kind of call that your worst case scenario on the plans, right? So these plans have a worst case scenario, a cap, where if you hit that cap, you're done paying for medical costs for the rest of the year. Okay. Any questions about that? Those are kind of general rules of Advantage plans and things to keep in mind with supplements without going into too much detail. You've got your drug coverage in Medicare, right? That's a big one. This is one, I think we'll probably end with this given the time. Drug coverage is probably one of the most confusing and frustrating topics for people on Medicare. All Part D coverage, right? Whether you get it as a standalone drug plan with a supplement or whether you get it bundled into an Advantage plan, they all follow this same standard of coverage. They all have to follow this. So one of the biggest questions I get from people every year is there some kind of help or coverage I can get to help me with the coverage gap or the donut hole? Has anybody ever heard of that? Coverage gap, donut hole? That's when your drug costs take a big jump up in cost, and it could happen any time in the year. You've got these four phases. The first phase is deductible. If your plan does not have a deductible, then you don't need to worry about that. You move on to the next phase, okay? Phase two. In the initial coverage phase, this is where most people are hanging out all year long and they never know any different. They just pay copays for their drugs and that's all they're worrying about, right? But there are certain people that are just unfortunate or have bad luck enough where they have to be taking certain brand drugs, right? Where generics just aren't available. I feel bad for those people because it's really expensive to pay for those drugs. And throughout the year, it gets even more expensive because of this lovely model that Medicare has created. Okay. As you see over to the right, I'm going to take you over here to the right, right? Once your total drug costs reach $4,660, total drug cost means this, not only what you are paying for a drug, but also what the insurance company's paying. So if you're getting, let's say, Lantus, right, a really common insulin, let's pretend Lantus retails at $500, okay? Well, in a lot of these plans, thanks to the good coverage you have, you may only pay like a $45 copay for that Lantus, right? Well, what about the other $455 that's being covered by the insurance company? Both of those amounts, your amount and the insurance company's amount, go towards taking you to that $4,660, which once you hit, you enter the third phase of coverage, the dreaded coverage gap or donut hole. Once you hit that phase, You no longer get to pay these nice copays anymore. Now you're paying 25% of all of your drugs, generic, brand, everything. You're paying 25% of the cost. And you continue to pay that along with, fortunately, drug manufacturers help cover a big portion of that cost. Typically, they have to offer a manufacturer's discount of around 50% of the cost of that drug. So they're paying about 50% of the cost of the drug. You're paying 25% of the cost of the drug. The insurance company's picking up that difference, but all along the way, you're still paying 25% of that drug, right? So going back to the example of Lantus, right? If it retailed at $500, instead of paying that $45 copay you were paying, what are you paying now? I'm not the greatest at math. What's a quarter of that? 125, right? So you see that big jump up in cost, and that's sometimes where I'll get a call from clients in the middle of the year saying, why did my costs skyrocket, right? I'm taking the same drug, now they're just charging me for it. Now you know why, right? That's a donut hole in action for you. Now, in this coverage gap where you're paying your 25%, right? The drug manufacturers giving their 50% discount, your 25% and their 50% discount go towards hitting this $7,400, which once you hit that number, you enter this final phase of coverage, which finally gives you a little bit of a break again. That's where you're paying around a $4 copay, a $10 copay, or a 5% coinsurance, whichever of the three is greatest for your drugs for the rest of the year. So on drug coverage, you never hit a cap where you get to stop paying for the rest of the year. Unlike the medical portion, right? You could hit a medical cap on your medical costs and be done paying for the rest of the year if you hit that cap, but there's no cap on drug coverage. You're paying for that for the rest of the year, okay? If you hit the catastrophic coverage, at least you're getting cut quite a bit of a break, but you should be getting cut quite a big break because why? You just had to pay a ton of money to get there. So they're finally giving you a little help in that final phase. Does that make sense? Not a very fun topic, but it is what it is. The only way I can think to tell people to escape it is don't take brand drugs. Does that help some people? Nope. Some people just have to take brand drugs. So my only advice would be just get generics wherever you can. If you're not sure if it's a generic or brand, talk to your doctor and just make sure. I come across people all the time that we find out they're taking brand drugs when there's a generic available. That is the most infuriating thing I find about when I'm trying to protect my clients from having to pay more than they have to, and I see they're paying for a brand drug when there's a generic available. That is frustrating, but then we get it fixed, okay? Any questions about that? No questions, right? Because you all understand that 100% now, how drug coverage works. Okay, so that's pretty much it.
The other comment on that is you do need to check with your Advantage plans drug coverage, what they are covering this next year, because they can change the way they're not only from year to year, but even during the year, they can make changes to how they cover drug costs.
That's the truth. Did everybody hear that? That makes sense? That is one of the reasons we advise doing an annual review, just to make sure nothing drastic has changed on your coverage. Again, because your coverage has been good this year, 2022, does that mean it's going to be the exact same next year? As a matter of fact, I can almost guarantee it will not be the same next year. I don't know of a single plan where every single benefit stays the same. They're always changing things. So this is just something to kind of throw out there. Again, ignore references to United Healthcare. This is not a United Healthcare presentation, right? But again, what we do in an annual review is make sure if we're looking at something that could be a better fit for somebody, we make sure their doctors are covered, their prescriptions are covered in the most ideal way for the option we're looking at for them. We check to see if maybe they might be eligible for Medicare and Medicaid, because if you have both Medicare and Medicaid, you're eligible for an entirely different set of plans that most of the general public cannot even get, where your benefits are even better, crazy better, okay? And then, yeah, there's my information. You have any questions? So any other questions? Yeah.
I have a comment here in the chat. I haven't read this whole thing, so let me read it to you. I suggest you have him address that on Medicare Original and a supplemental, not true with medications, after you pay your deductible, which is usually a couple of doctor visits, you pay no copays or 20% payments. Also, Advantage plans don't cover things like fusions, that is for RA, which for me are almost $6,000 a month. Each person should really consult with an advisor. You want to comment on that?
That's good advice. I could add to that. Yeah, basically going back to a supplement. For the most part, the benefits between an Advantage plan in terms of what is covered and a supplement, they're similar because it's basically Medicare approved benefits, right? It's going to be what's Medicare approved and what's not. What that person was specifically referring to is likely what's called a Medicare supplement plan G. Has anyone ever heard of a supplement plan F? Yeah. F kind of used to be the big deal in the market, right? A plan F was basically, again, Medicare pays the first 80%, and then your supplement pays the remaining 20%, like we talked about earlier, right? That's how it works in a plan F. Plan Fs are not available for most people anymore. So a lot of people now will get what's called a supplement plan G instead of a plan F. And what they're referring to is on a plan G, you have to pay the Medicare Part B deductible, which for next year, I think it'll be, I think it's $226, which is what that person meant when they said, you can likely meet that deductible in a doctor visit or two, right? Where you pay that $226. Once you do, then this coverage kicks in, this 80-20, where Medicare is covering the first 80%, the supplement's covering the other 20%, and therefore what percent is left for you to pay, like we talked about? 0. So that's what they're referring to. So that's true. They were referring specifically, most likely, to a plan G. Although there are other supplements besides a G, where you also have to pay that deductible, but you have to pay other things as well. A G would be the next simplest, besides a plan F, which just, on a plan F, you don't even have to pay the $226. You just right from day one have the 80-20 coverage. But again, those aren't available for most people. Most people now, the next closest thing they'll get is a plan G.
What's the fusions she was asking about?
It's just one of many different things that people may need to do. It kind of all depends on the Advantage plan you have and if it's Medicare approved. So typically when somebody's wondering about a certain procedure that is covered, especially if they're on a supplement, it never hurts to call Medicare and find out, because when you have a supplement, you're dealing directly with Medicare, right? Typically, whatever Medicare is going to cover or approve, the supplement is a secondary, will kick in and pay as well. But it all depends on whether Medicare approves it. How do you know if Medicare is going to approve it? Most people out there that I know of that do what I do, for example, there's endless number of procedures and things that can be done, an endless list of things. So the safest thing to do is call Medicare and find out, is this particular thing covered? Same thing on an Advantage plan, frankly. That's a good practice to follow. Before you go do something that might be a $100,000 surgery or a $20,000 shot or whatever it may be, call and talk to your insurance company on an Advantage plan. Talk to Medicare when you have Medicare with a supplement to make sure something is covered. But what she said is true. As long as a fusion or insert any procedure, fusion, whatever it may be, right? As long as it's Medicare approved, right? Then the supplement will kick in as a secondary and pay that 20% difference, or leftover, I should say. Did you have a question, John? Okay. Was that helpful? Okay.
All right. Thank you. So your last slide, if you would, for everybody to look at this again, ignore the part where he says talking about United Healthcare. But I ask that each one of you, again, we've talked about this before about being informed. If you have questions about your insurance, just like we talk about questions about voters, find out, talk to your agent, talk to an independent agent, get information. What does this mean? Part A, B, C, D. If there's a part Z on beyond zebra, find out. It helps for you to know and be informed, because again, this is your money. And this is that you're getting bombarded with, excuse me, lots of ads, lots of things in the mail, as Jake was talking about. But the important thing is to get informed, to ask questions. And so you see right here, here's the things to ask. Ask it an independent agent. You can ask Jake, you can ask anybody. I mean, there's lots of independent agents out there. They cover all sorts of different plans. The important thing about this presentation was be informed. understand what's best for you. Find out if you're eligible for more benefits. How can you keep more money in your pocket? So appreciate Jake coming and doing this. Appreciate you being here today. Thank you. Have a great afternoon. We will see you tomorrow for the last day of this semester.